Coming to the muscle spindle, which are a sensor receptor for stretch reflex. The muscle spindle contains two types of fibers, extrafusal fibers and intrafusal fibers. Extrafusal fibers, they are regular contractile units of the muscle, whereas intrafusal fibers, they are muscle fibers in the muscle spindle, which is the sense organ for the stretch reflex. Each muscle spindle consists of 10 muscle fibers, and these fibers are enclosed in a connective tissue capsule. These fibers are more embryonic in character. The fibers in the spindle have less distinct striation than the rest of the muscle fibers in spindle. The ends of the capsule of the spindle are attached to the tendons at either end of the muscle or the sides of extrafusal fibers. Only the ends of intrafusal fibers are contractile. There are two types of intrafusal fibers in mammalian muscle spindles. These are called as nuclear bag fibers and nuclear chain fibers. Nuclear bag fibers, they contain many nuclei in a dilated central area, and so they are called as nuclear bag fibers. There are two nuclear bag fibers per muscle spindle, and nuclear bag fibers are of two types. Nuclear bag fiber 1 with the low levels of myosin ATPase activity, and nuclear bag fiber 2 with a high level of myosin ATPase activity. Nuclear chain fibers, they are thinner and shorter and lacks definite bag. There are 4 or more nuclear chain fibers per muscle spindle, and their ends connect to the sides of nuclear bag fibers. If you see the sensory innervation to the spindle intrafusal fibers, it occurs through the group 1A and 2 sensory fibers. Sensory nerve endings in each spindle are of two types. They are primary endings and secondary endings. Primary are annulospiral and secondary are flower spray endings. Primary endings are the termination of rapidly conducting group of 1A type of afferent fibers. One branch of IA fibers innervates nuclear bag fiber 1, and another branch innervates the nuclear bag fiber 2 and the nuclear chain fibers. These sensory nerve fibers wrap around the center of the nuclear bag and nuclear chain fibers. And secondary fibers, they are the terminations of group 2 sensory nerve fibers and are located near the end of the intrafusal fibers, but only on the nuclear chain fibers. If you see the motor innervation to the muscle spindle, it is the only organ receiving motor innervation, and the motor innervation comes from gamma efferents, that is of leg shell. They are the smaller motor neurons, and they go to exclusively to muscle spindles. The endings of gamma efferent fibers of two types, plate ending on the nuclear fibers, they are nominated as gamma 1, and trail ending on the chain fibers, they are nomenclated as gamma 2 fibers. Beta motor neurons, they are the larger motor neurons, and they innervate both intrafusal as well as extrafusal fibers. This is the diagram showing the intrafusal fibers of the muscle spindle. They are the nuclear bag fibers, they are nuclear chain fibers. Nuclear bag fibers, they have a dilated portion in the middle. And if you see the innervation, they have a primary and secondary afferents, whereas primary afferents, they come from both the annulospiral endings of nuclear bag fibers and chain fibers, whereas secondary afferents, they are going to arise from the flower spray ending, which comes from the nuclear chain fibers. And if you see the gamma innervation, that is the efferents to the muscle spindle, the gamma 1 is going to innervate both the nuclear chain fibers and bag fibers as a plate endings and trail endings, whereas gamma 2 fibers, they innervate mainly the nuclear chain fibers as a trail endings, whereas beta efferent, they innervate both the intrafusal as well as extrafusal fibers. Response of muscle spindle to stretch. Functionally, muscle spindle shows two types of responses, that is dynamic and static. The dynamic responses by nuclear bag fibers. Here the primary sensory nerve endings discharge impulses at rapid rate when muscle is rapidly stretched. They fire less rapidly if stretch is continued. The discharge of impulses starts only if there is a change in the degree of stretching of the muscle. Thus, the response depends on the rate of change in the length of the muscle. Whereas static response is seen by nuclear chain fibers. When stretch is continuing, static response comes into play. Thus, muscle spindle gives response to change in the length of the muscles as well as rate of change in the length. Mechanism of activation of muscle spindle. Intrafusal fibers are parallel to the extrafusal fibers. When the extrafusal fibers are passively stretched, the stretch is transmitted to the intrafusal fibers. There will be stimulation of 1A fibers, which causes stimulation of the motor neuron and which leads to contraction of the extrafusal fibers, which constitutes the stretch reflex, and that leads to shortening of the muscle belly. Stimulation of gamma efferent produces the contraction of the intrafusal fibers. The stretches that stretches the nuclear bag portion of the spindles, and again there will be stimulation of 1A sensory fibers. Again, that is going to stimulate motor neuron, which causes contraction of the extrafusal fibers. Again, it is going to lead to stretch reflex, causing the shortening of the muscle belly. Thus, muscle can be made to contract via stimulation of a motor neuron that innervate the extrafusal fibers directly, or stimulation of gamma motor neurons that initiate contraction indirectly via stretch reflex. Stretching causes contraction of the extrafusal fibers and shortening of the muscles. Thus, spindle discharge decreases. The spindle and its contraction constitute a feedback circuit, thus maintaining the length of the muscle fiber. Functions of stretch reflex. It is important for maintenance of a posture. Maintaining posture, that is, or changing the posture, are affected by the appropriate adjustment of gamma motor neuron activity of different group of muscles. The role of muscle spindle in voluntary motor activity. Normally, for initiation of skeletal muscle contraction, stimulation of motor neurons are necessary. Along with the motor neuron firing, the gamma motor neuron also fires concomitantly so that skeletal muscle contraction can be made effective, and which is called as alpha gamma linkage. Imagine what would have happened if this do not occur. Stimulation of the motor neuron causes initiation of the contraction of the skeletal muscle fibers, but this contraction will cause, as there is now shortening of the extrafusal muscle fibers, relieving the stretch on the nuclear bag fibers, causing the 1A afferents to stop its discharge. This in turn will lead to lengthening of the extrafusal fibers. That is cancellation of the motor stimulation effect. The concomitant firing of gamma efferent is going to prevent this. Other function is damping action. An important function of stretch reflex is its ability to prevent oscillation or jerkiness of the body movements. This effect can also be called as a signal averaging function of muscle spindle. And the fourth function is also play an important role in the maintenance of the muscle tone.